And it's a Tuesday. That means Talk to the Doc, or today, Talk to the Docs, as we welcome in Dr. Tim McKnight from Trinity Hospital, Twin City, and Dr. Mike Jakubowski from Twin City Chiropractic, presenting our program, of course, Mako's Pharmacy in downtown Uricksville, and Twin City Chiropractic, 205 Grant Street in Denison. Doctors, good morning.
Good morning.
Good morning.
How is everybody doing today?
So far, so good.
Yeah, this is just really such a unprecedented times in our world. We're like pioneers every day trying to forge our way and get through this thing, but we're going to do it.
Yeah, we're going to do it. We have no choice, right? But I guess we're learning, and we're all trying to help each other and support each other as we get through something that we've never anticipated and not sure how to negotiate.
And I'm assuming, especially in a hospital environment, it's been completely Twilight Zone times as far as just a different atmosphere.
It feels like a holiday week. You know, we're just not seeing people. But I'll tell you, the last week or so, we've seen a few more people in the office, so that's encouraging. Mm-hmm. But I think it's going to be a while before we're back at full strength.
We talked about telemedicine and how that is working out with the technology works for you. But Dr. J, I guess in your situation, it's kind of hard to stretch somebody out and do what you do over a video conference.
Sure, and that's what you listen to the news, and we're starting to see other health issues start to pop up for people not using their physicians to see for other issues they may be having. And that's important too, is of course we have to worry about the virus and staying healthy that way, but it's important to see Dr. McKnight for things that we need to take care of and just not ignore. And of course in my office, and I think that's why we're still seeing people, is, hey, if you're not showing signs of the virus, if you're not sick, and you have aches and pains, we can't just ignore them because it leads to other health issues. Right.
We had talked, and it's great, the two of you, how you work in sync with each other. If you see a patient, Dr. McKnight, that is having some issues, maybe pain in their back or sciatic or whatever, and before you go in and do something with a surgical procedure, you kind of point them in the direction of Dr. J, and we had mentioned a patient in that situation that you were sending his way. Let's kind of refresh everybody about that story and where we are now.
Yeah, she had come in to see me because she needed an MRI. Another provider had suggested she get an MRI, thought she had a herniated disc because she was having some leg pain. And I did the examination, was trying to document so we could approve the MRI. And I felt like this was not coming from her spine, but from her hip and from her sciatic nerve. Felt there was a muscle involved, and I thought, before we go ordering the MRI, let's go see Dr. Jakubowski and see if he can help us. And Dr. J can tell us what the response is.
So you've now seen this patient.
I've seen this patient, and actually Dr. McKnight sent her over for some myofascial release or active release technique, which we touched base on last month. And a muscle in the hip called the piriformis muscle that the sciatic nerve runs right by, as when it becomes tight, it can actually help compress that nerve and create sciatic-like symptoms, or that pain that's running down your leg. Sure. So releasing that muscle has significant improvement in her condition just in about 3 to 4 visits.
And so potentially alleviating a surgical procedure that would be much more lengthy as far as rehabbing and in all essence really needing to be done, this could have or hopefully alleviated this situation.
Yeah, we still don't know if she doesn't have a herniated disc or a problem with her spine, but we know that her pain is resolving, and that's what she cares about. So until we see other reasons to do that MRI, this is the approach we should take.
Isn't it possible, though, that with this situation, that if she starts to get treatment and you start to strengthen it with exercising and the stretching and everything else, that this could really give her the movement and the no pain situation is what we're all looking for, as opposed to taking out the knife and doing surgery.
Sure. And what we find is, and like Dr. McKnight said, does she have a disc herniation? Well, we know a lot of the population If we MRI people that don't have any aches or pains, we can see, they have a bulging disc in their back or a herniated disc in their back. But that doesn't mean they actually have to have pain because they have those things. There's so many things involved, muscles, joints, it's all mechanical. It's like a machine working. And if you get it all working together, inflammation goes down, pressure comes off of nerves, and of course, people do a lot better. If it is a herniated disc, eventually it's going to, that will come to surface here that this is not going to work, or something along the way will tell you that, the next step is needed. Yeah, that can happen, but I'd say most of the aches and pains that we see in low back or even neck is a lot of times bulging or herniated disc. And what we like to do is classify those, and we classify them as small, medium, and large. And when you look at a disc, the joint in between your bones of your back, think of it like a jelly donut, and that gel starts to push its way out and causes a bulging or ballooning of the disc. Well, our body feeds off of motion. Every joint in our body, as we move it, synovial fluid rush in, feeds the joint tissue, and inflammation leaves. So if we have a bulging, herniated disc, if we get mechanics moving right, we get fluid moving right, we can actually reduce inflammation, reduce some of the bulge or herniation, and then people feel better. So we can see people live with a bulge or herniation their whole life as long as they manage it, exercise, eat properly. Because we know metabolic syndromes like diabetes, people that smoke deteriorate joints faster. And obviously associated with herniations and bulges. And obviously you want to try to avoid going in and doing surgery on something like that. If you can fix it this way, it's obviously much better for the patient and the outcome for them. Yes, definitely. And when we see people in the office, sometimes we'll be like, wow, this is a bad disc herniation. And there is certain situations where you're like, okay, this is a type of problem that if we send them to a surgeon, they're going to do really well with the surgery. And there's other times where we look at it and go, okay, wow, if I send them, they may do pretty good, they may not, it may last for a while, we just don't know. But when we see certain situations, we know, wow, we'll send them, they'll feel a lot better, and they're going to have long-lasting effects from the surgery. And in this case, with this particular patient, this is exactly how it should work. Medical doctor sees it, instead of signing off on getting the next test and getting ready for surgery, pointing her your way, and you're getting great results. So, this is exactly what both of you hope for in a case like this. Yeah, and Dr. J keeps talking about mechanics. That's really the key to every joint is proper mechanics, proper muscle balance, flexibility, joint movement. And many of us have poor mechanics because we sit, we do repetitive work, we do lots of lifting. So Dr. Jakubowski's taught me a lot about mechanics and proper movement, and that's really the hard work of managing back pain, because it requires some stretching, it requires some strength training. It's a commitment to do that. But if you don't, you're liable to have a problem that progresses over time, and then the only option you may feel you have is surgery, and that's not always the case. So the other thing I've learned from him is that when you have back pain, he just mentioned that a lot of times when we see a herniated disc and, let's just fix that herniation, the surgeon will tell you, well, there's a 50% chance you're still going to have pain. Well, wait a minute, you just said you were going to fix that. Why would I have pain? It's because there's so many other factors involved. He mentioned the joint. There's arthritis in the joints. Right. That jelly-filled donut that he's talking about looks like a tree ring, and so there's fibers that wrap around that in circular fashion. If those tear, there's nerves there. Those will hurt. Then you can have tight muscles. You can have a herniated disc itself. Right. So you can have nerve impingement. There's so many things that are involved in pain that people just need to trust somebody like Dr. Jakubowski. And he's the kind of guy that if you've seen him a few times and it's not improving, he'll tell you, we need an MRI, or, this isn't going to work for you. There's something else going on. Good to know. We're talking with Dr. Tim McKnight and Dr. Mike Jakubowski, Trinity Hospital, Twin City. Of course, Dr. McKnight's on staff, and Dr. J is with Twin City Chiropractic in downtown Denison. This time in our world where people have been sheltered at home here for over a month now, I'm guessing less activity, less physical movement. How is this playing out in our world and what you guys do? Sure. In my office now, a lot of patients are coming in saying, I was exercising a lot more. When it's nice outside, I can get outside and walk. And that's where the mechanics come in. When we're moving, that fluid's going through our joints, we feel better. Just like arthritis, you get up in the morning, you're like, boy, I'm so achy. But as I get moving, I feel better throughout the day. And now when weather's bad, we're sitting around more, we're eating more, we're having those comfort foods, and all that's contributing to inflammation building. We're not moving. It puts more pressure on our joints. So it's affecting not only us mentally, being locked up kind of, but physically too, because we can't move around as much. And that's what we're seeing coming to office. I have more back pain. I have these aches and pains, and we're just trying to get those mechanics moving better.
So important, and it's kind of funny how this all falls in line with the layout of Fit for Life. I mean, it all falls together. You can't. We're a machine. You can't stop moving the machine. It has to keep motion to keep feeling fit, and this is what is happening in our world today. Right. We're stressed more. We're more depressed during this time. So thus, we're eating the wrong foods, more of the wrong foods, and less exercise. We're sitting in front of the TV more often. This is a perfect storm brewing, basically, in our bodies.
Yeah, and we've had Dr. Jakubowski's back pain lecture has been part of Fit for Life since we started, and it's so critical because so many people have problems with it. And for myself, I also have had back pain and have had to learn to deal with it, and he's helped me understand it, and that's empowered me. Had I gone down the other path 15 years ago, I'm sure I would have either had injections or some type of surgery, and I think I'd be much less active if I'd done that. So just understanding it, being empowered with knowledge, and then committing to exercise and restoring the mechanics is huge. It really brings hope to a lot of us who suffer from back pain.
And that's what I think Fit for Life does. And when I look at a patient come into the office is do most conservative type of care that we can give, eating right, exercising. Boy, this isn't working. They come see me. I try to treat it. Physical therapy. Oh, this isn't working. Let's go to do injections or, get more aggressive as things don't work. This way, when you get to that last step, if it is surgery, boy, I've tried everything and nothing's helped me. And now I'm going to do this. This way you're not guessing.
Great advice. This is why we talk to the docs, and you're at 205 Grant Street in downtown Denison. How can people reach you to get more information?
Yeah, so our phone number is 740-922-2325. If anybody just has a question that they want to ask me, if I get a break, I'll call them back about aches and pains and see how we can help them.
And you have an associate with you in the office as well.
Yeah, Dr. Andy Wurst. He's the best. He's my brother-in-law, actually, and he's a great doctor, too.
Get a hold of Dr. J or Dr. Wurst at Twin City Chiropractic, and of course Dr. McKnight on staff at Trinity Hospital, Twin City. Just great advice as always. And gosh, Fit for Life ended before the program wrapped up, which was a first for that. But we're talking soon here about the next session. I'm really hoping that everything can pan out, that we can do that in September.
I hope we can do too. We have 2 more sessions to finish with the class that we started, if we can get to that. But we're hoping to be able to do it again in the fall.
Gentlemen, thank you. As always, keep up the great work, and I love how you guys work in sync and are helping people feel better and enjoy life. That's what it's all about.
All right, thanks.
Thank you.
Dr. J and Dr. McKnight in studio with us. And again, you can get a hold of both of them at their offices for more details. And as always, we will have this interview posted as well as a podcast. If you missed something that we said, if you want to hear it again, it'll be up and running for you in just a matter of days. That's today's edition of Talk to the Docs, again presented by Dr. McKnight and Mako's Pharmacy in downtown Uricksville and Twin City Chiropractic on Grant Street in Denison.